Welcome everyone. So the topic which we will cover is vaginal candidiasis. It is a condition in which opportunistic infection occurs. It is not an STD. It is not sexual transmitted disease, but it is infection which is caused by yeast-like funguses. That's why it is known as vaginal candidiasis. Now the risk factor for this is immunosuppressive patient like patient of HIV, pregnancy, antibiotic dose, high dose of combined oral contraceptive pills, and anemia. These are risk factors for development of vaginal candidiasis. Now, clinical feature for this condition is most commonly patient are asymptomatic, but if patient has symptoms, so that his symptom will be itchy, vulvar itching, erythema, and fissioning. Smell will be yeasty, color will be white, and consistency will be curdy. pH is less than 4.5, and diagnosis is on the basis of microscopy and culture because it is caused by fungus. So the management of this condition will be giving patient symptomatic treatment and along with clotrimazole and fluconazole should be given to the patient. If candidiasis is present and it is more common in the pregnancy, so topical imidazole should be given to the patient. And another disease is bacterial vaginosis, which is caused by bacteria and abdominal vaginal discharge in the woman in childbearing age can predispose to this condition. In this decreased lactobacillus and vaginal flora can create problems, and a female who are uh, new sexual partner and having dowsing, smoking, black race, and HIV patient may predispose to this bacterial vaginosis. Now, the increased risk of HIV acquisition is observed in the women with which having bacterial vaginosis. So, the commonly bacterial vaginosis is caused by Gardnerella vaginosis, Bacteroides mobilis, and Mycoplasma hominis. So the clinical features for this disease is itching will be absent, smell will be offensive and fishy in nature, color will be white and yellow, consistency will be thin, and pH is 4.5 to 7, and diagnosis is on the basis of microscopy. So in this way we can diagnose. If once it is diagnosed, and then we can treat accordingly. And whiff test is the test for diagnosis of the bacterial vaginosis. Clue cells are the cells which are present in microscopy, which are squamous epithelial cells with bacteria adherent to their wall, is the diagnostic point on microscopy. Now, the complication for this disease is pelvic inflammatory disease can occur, pelvic infection after gynecological surgery, second trimester miscarriage with perineum rupture of membrane, and perineum delivery can be occur in this disease. So, the management for this disease is metronidazole should be given, and clindamycin should be given oral or vaginal. Both of these are oral or vaginally given, clindamycin and metronidazole. In this way, we can prevent occurrence of the bacterial vaginosis. Now, the another condition is trichomoniasis. It is a disease which is caused by flagellated protozoan Trichomonas vaginalis and caused by punctate hemorrhage with cervix and giving appearance of the strawberry cervix. It is the important and high yield point that strawberry cervix occurs in trichomoniasis, and the feature of discharge will be itchy is present, and the offensive smell with a frothy and greenish discharge, and consistency will be thin and homogeneous, and pH is 4.5 to 7. Diagnosis based on the microscopy and culture. So diagnosis for the diagnosis NAT test is performed for vulvovaginal, rectal, and urethral swab. It is most accurate test, and then wet mount microscopy should be performed, and then culture will be done, and culture will show moving flagella. And the complication of the disease is the enhanced HIV transmission, pregnancy related associated complication like preterm delivery, low birth weight of the baby, and maternal postpartum sepsis can be developed. Treatment will be metronidazole, clindamycin, and antibiotics. Others should be given. Contact itching should be treated in the treatment in the partner, and then refrain from sexual intercourse until the partner is treated. In this way, we can manage this disease. And another is gonorrhea. Gonorrhea is caused by it is sexual transmitted disease caused by Neisseria gonorrhea, which is gram-negative Staphylococcus bacteria. It colonizes the columnar epithelium of genital tract and transitional epithelium. It is present along with chlamydia infection in 50% of the cases. It is most commonly asymptomatic, but sometimes present with the vulvovaginal discharge, itching, burning with dysuria, painful urination, rectal discomfort with bilateral abdominopelvic pain occurs to the woman, and upper genital tract is involved. Complications of this disease are PID, pelvic inflammatory disease can occur, Bartholin abscess, or skin abscess, tubal infertility, increased risk of ectopic pregnancy, and disseminated gonococcus may present. Now, in disseminated gonococcus, patient had fever, pustular rash, and a migratory arthralgia with septic arthritis along with monoarticular joint pain in the patient. That is disseminated gonococcus infection. In pregnancy, patients are frequently asymptomatic but may develop preterm rupture of membrane or chorioamnionitis and preterm birth with postpartum endometritis. In neonate, the complication of this disease, gonorrhea is ophthalmia neonatorum occurs in which uh, neonates are predisposed with the infection, most commonly in eye, and that creates blindness and corneal scarring. This is very dreadful and dangerous condition for neonates especially. So this must be treated immediately in order to prevent blindness in the neonate. Now the diagnosis is on the basis of NAT test, culture, NAT test, positive testing of the STD is important for chlamydia. Treatment is dual therapy with ceftriaxone and azithromycin. So these both drugs should be given, and contact tracing should be done with refrain from the sexual intercourse. So these were the infectious disease which should be treated immediately in order to save the life of the patient.